Medical Dilemma.
Same father.
Welcome back to Medical Dilemma. Before we start our discussions for the third segment, I would just like to mention our special sponsors, Makati Medical Center, St. Clair's Medical Center in Palanan, Makati, LifeQuest Training and Consultancy Corporation, and its partner, Manila Workshops. Now, fresh from his holiday, I'd like to welcome back our co-host, Father Jerry Manlangit.
Thank you, Sunny, for having me back here.
Thank you so much,
Father, you did not change. No weight gain, no loss gain.
Okay, now earlier in the second segment, we talked about a case where a woman is found to have cervical cancer and at the same time is pregnant. Maybe I'd like to direct the question to Dr. Gonzalez. So what do we do in that case?
We first determine how far or how advanced the pregnancy is. The general rule is before the fifth month of pregnancy, we disregard the pregnancy and treat the cancer as if you were not pregnant. Beyond the fifth month of pregnancy, we will allow her to deliver the baby at term by cesarean section, and then the treatment for cervical cancer would be started.
Why the fifth month?
Because it would be too long a time to for the baby to be delivered at or before the fifth month, and that would allow the cancer to grow. That's the tendency of any cancer to grow with time. So the thinking is it's too long a time to wait. So before the fifth month, there is urgency to treat the cancer.
If you have cancer, will it affect the baby? I mean, will it spread to the baby or what?
Spread
Inside?
of cancers to the baby is very rare. That happens for some types of cancers like melanomas, but that's very rare. What we're afraid of, whether the pregnancy is early or advanced, is that the effects of the cancer on the mother would have effects on the baby. Like it might cause malnutrition on the mother. She might be bleeding, so she would be anemic. For other cancers like cancer of the throat or cancer of the stomach, that impacts directly on nutrition of the mother. So the baby would be affected seriously for those types of cancers.
I see.
How about father? There's a dilemma here,
Yes,
right?
yes.
Well,
Father Jerry, yes.
of course, there is a dilemma because sometimes people think that because they treat the mother of her cancer, they might also kill the baby.
Yes.
But you see,
Possibility. Yeah.
well, the principle of bioethics agrees well with what the OB-gynecologists are doing. Treat the mother, treat the cancer, as if though it is a regular thing that they do, even if she is pregnant. If something happens to the baby during the treatment, then call it as part of the principle of double effect, which is a very strong principle in bioethics, which everybody agrees. The principle of double effect says that, well, for as long as what you're doing is something good or something indifferent and not directly something which is evil, that is agreeable. And secondly, for as long as the beneficial effect is the one that is foremost in the mind of the OB-gynecologist or the doctor treating it. And the third is that the beneficial effect and the harmful effect must be equal, or at least, or the beneficial effect is greater than the evil effect.
I see.
And the fourth, which is very important in the order of time, that the beneficial effect should come first or at the same time with the harmful effect. So in this case, for example, if you treat the mother or the cancer, and it happens that there is also effect on the child, let's say on the chemotherapy, that is very much acceptable, ethically speaking. There might be, of course, dilemma because people are not well educated as to why are you doing this? You are killing the child. No, the purpose is to treat the mother. It so happens that in the treatment, there is also a harmful effect, which will cause probably the child to have some deformities or may even kill the child. But it is well agreed or accepted in ethical circles.
Does the patient have a choice? In other words, if the patient wants to have the baby, it's a precious baby, the first baby, will you
course
allow
there
that,
is.
Father?
There is always. It is always a choice. It is always a choice. Well, if the mother says, no, I want the baby, even if probably
Die afterwards.
She dies, well, it's her choice. We cannot do anything about it. What can doctors do?
The doctor's obligation would be to inform the
Right.
patient on what options are available, what may happen with this way of treating, what happens if she does not undergo treatment. But
Okay.
we always emphasize it's the patient who decides for
Right.
herself.
Right.
Because that's her right.
How about the opinion of the husband? Will this come in, Father?
Of course, of course.
What if
Because,
they disagree, both?
there's where again the big dilemma. Counseling, as Doctora said, in the second segment, they should undergo counseling.
In the
Because
meantime,
probably there
the
are
cancer
biases
grows.
and prejudices that probably the husband is unable to solve or resolve. Then counseling is the better
Very
choice.
important. But in the end, Father, in ethics, it's the right of the patient to self-determine. It's your own body.
You're right, but you're
Yes.
married.
Yes. So
You
you
are
have to
supposed
consider the
yes,
opinion of
you're
the
married
husband.
because in marriage you become one. The body of the woman is the body of the husband. The body of the husband is the body of the woman.
So it really becomes a dilemma.
Right.
Well, that's in the
Yes.
RH law.
That's right.
Oh.
It's really a dilemma. That
It's
is
in the
why
RH law.
in those cases, better the couple should be one.
Oh, but if the husband will not respect my opinion, for example, then he doesn't love me enough. Because, right?
Maybe you can say that, etc. Again, I believe there is a lot the doctors that can do to persuade the husband. In my experience in the hospital, many of them will say, okay, go ahead, because they have not been educated well enough as far as these conditions are concerned.
Do the doctors have a role to try to persuade them?
Oh, of course, in a doctora.
Our role actually is to inform, to disclose, but not to persuade.
That's right.
Right.
And
Enlighten, just
in
enlighten.
in our
them, no?
culture,
Yes.
you talk to the whole family.
Yes.
Right, you're right.
Not just to the patient
You're
or the
right.
husband.
Oo nga.
You
Although, yeah.
talk to the whole family.
It is said that
And
we
the other
are a
children, I
patriarchal
guess.
society and minsan may pasyente magsasabing, Doktor, pangalawa sa Diyos, kayo na yung
Right.
susundin ko.
As a matter of fact, disease is a family business
Yes.
in the Philippines.
In the
In
Philippines.
America, it's my body.
That's right.
You cannot decide except myself. Yun ang difference of the culture between
That's why I said,
Americans.
Father,
just
it has to
curious,
be a family counseling.
You're right. You're
Yes,
right.
I'm just curious, doctor. In that case where the woman is pregnant and she has cancer, if you treat the cancer, what are the chances that the baby gets killed in the process?
The main treatment for cervical cancer,
Mm.
whether pregnant or not, would be an operation, a
Yes.
radical operation or radiation.
Mm.
Both would kill the baby.
Both definitely will kill the baby.
Because during the surgery,
Mm.
the uterus, which has the cancer,
Mm.
is taken out.
Taken out.
So the
Yes.
baby's inside. The blood vessels that supply the baby
Mm.
are cut off. So, but in the sequence that Father said, the tumor is taken out first before the baby dies eventually. Now with
Okay.
radiation, the same thing happens.
So there's really no chance for the baby to survive.
no chance to survive radiation or surgery.
Okay, so that's very clear now. Okay. Now,
That's very,
because
very difficult.
I understood it earlier as if there's a way to balance, between the good effect and the hard effect.
Right.
So now it's really the mother or the child.
Right. So,
Yes.
so the beneficial effect, which is the treatment of the mother,
Mhm.
and the harmful effect is probably the death,
The death
of
of the
the baby. But you see, between the two, the baby and the mother, they have the same value.
Mhm.
They have the same, they are both important.
Mhm.
The life of a baby and the life of the mother.
Mhm.
We cannot discriminate between the two as if the life of the mother is greater than the life of a baby. We all have dignities, and such dignity can never be decimated by anyone.
Mhm.
That is why we have always to take into consideration these two values, the life of the mother and the life of the baby, which are both important. If in the course of the treatment we can save both, that's better. We'll be happy.
Which
Yes,
is
yes.
easier during the advanced
Advanced.
parts of
Yeah.
pregnancy.
All right.
Okay.
Because
okay.
the dilemma there is how soon do we deliver the baby?
Mm.
The baby might still be premature.
Right.
So there is that risk of delivering a premature baby, which has its own complications, but at a better age
chance.
rather than much earlier. So we during the time we have the chance to save both the mother and
Right.
the baby.
I see. So beyond the 5th month,
Yes.
there's actually a chance for the baby to survive.
That's correct.
Okay. Okay.
Going back to another issue about the breast, no? Is it not only a choice but a moral duty on the part of a woman who develops breast cancer to try to survive, no? And do avail of all the modalities simply because the children are still too young? What do you think?
Yes, that's true.
So it would be good, but supposing it's costly, Father,
Well,
or he decides.
well,
that's
we have to factor into the equation the the affordability of them. But you see, life is very precious. Something that you cannot buy, something that you cannot just quantify through money. So between money or just affordability and that life we will always choose life.
and
Okay?
then
That is why in this case, no, in very advanced countries, it's the state that takes care of the economic side. That's for the advanced countries. But for us, masyado pa tayong malayo. Okay, kahit nga ay simple antibiotics, hindi na
afford.
bibigay
no,
ng...
hindi na
Although now,
bibigay ng
Father,
state.
PhilHealth has this Z package for breast cancer where they will give 100,000 for
Okay.
breast cancer patients.
Good enough. Okay.
If you are enrolled in PhilHealth with
Right.
cancer of the
Same
cervix.
with cervical cancer. If the
good
treatment
enough.
involves radiation
good.
or operation, the PhilHealth would give a significant amount of
Right.
money,
Already.
which would probably take care of 3/4 of the treatment
At
already.
least.
So along that line,
Yeah. The
there have been
dilemma there
improvements.
is that, well, it's good for those who are enrolled in the field
In
health,
PhilHealth.
but there's still millions of people who are
Who
not
are not.
enrolled.
Although
have
the
no
government is
access.
saying that if you belong to the CCT family and
You're
HTS
automatically
family,
enrolled.
you're automatically enrolled at
Enrolled.
point of contact, point of care.
And that will be good enough in that case. So that the state is now advancing as far as economic help is concerned. That would be good.
Yeah, before they just allowed a very small percentage of the entire budget to health, but now they realize that it's also helpful. Very
But you
much.
see, as I've mentioned before, well, the allocation of
Scarce
government
resources.
budget
Government funds.
for the population is only not even 5%,
Not even
Doctora.
5%.
Not even
That's
5%.
Yeah,
It's
unlike
only
in
about
other
2.3%,
Uh-huh.
which is actually a law,
We are below the WHO recommendation for health.
Roy, and we are way far behind other countries.
Yeah.
And that sometimes is the dilemma. But those who cannot afford,
Yes.
where will they go? As they say,
Precisely.
give more to those who don't have in law. Give more law, rather, to those who don't have.
Dr. Capito, another issue that was tackled earlier is that of taking out your healthy organs because you have the mutated gene.
Yeah.
Okay? And I think you mentioned that if you have that gene, you have a 45%
It's
chance
actually 55
of developing over
to
55%. Okay.
We have the example of Angelina Jolie.
Yes, yes.
She's positive for the mutated gene. I don't know if it's BRCA1 or 2, but she's positive. And she has a family history, so she had both breasts taken out, and later, even her ovaries were taken out.
Okay. My thinking is, even if the chances are high, like maybe 75%, you still have the other
25%.
25%.
Yes, that's true. Because
right.
you cannot predict if you will have
You
the
will
cancer.
develop it or
You're
not.
right.
You can just go through the more close or diligent screening. We have the mammography. We have the
Right.
Close monitoring
sonomammography,
maybe
close
of that thing, no?
monitoring, breast self-examination.
Father Jerry, what do you think of that?
That is why before, no, one of the principles in ethics is our respect for integrity of our human body, because this is something which is sacred. It's something which we did not make, but only the Supreme Being. So in the principle of integrity, or sometimes called totality, one of the requirements is this: you cannot sacrifice any part of your body unless it is for the better functioning of your whole person. But even then, with a means to compensate it. As for example, when you amputate a diabetic foot, well, you have to compensate it with a wheelchair or crutches, etc. That's part of the principle of integrity. Secondly, you can never sacrifice an organ which tells about your personhood unless it is for the preservation of life. Mga organs which tells about your personhood is
Whether you're male or female,
yes,
or something
correct.
like that.
Breast, sexuality, even the brain, because it tells about your personality. If you don't have a brain, who are you? If you don't have emotion, who are you? If you don't have sex, who are you? That is why these things cannot be sacrificed unless it is for the preservation of life.
Of life.
But let's go back to the purpose of a breast. Isn't the purpose is really to breastfeed your children?
Breastfeed your children.
Primarily, no? So if it has already done its function, the woman is already way into menopause, don't you think it's already okay to remove it? May I ask our
Okay.
also?
There's still, you
Yeah.
can't remove your ears just because it does not function anymore.
Uh-huh.
Okay. You
But
can't
but
remove-
but there's a threat of your health because of this cancer.
A threat
That's the
is a threat.
difference. Yes.
it's not always definite.
Uh-huh.
As a matter of fact, even if you remove it, it can still recur.
Yes.
Yes, that's true.
If you
It can
read
come back.
literature, even if you go prophylactic mastectomy, it's not a guarantee that you will not develop breast cancer in the future.
Okay.
Because there might still be some slivers of tissue left which will grow into breast cancer.
And it's possible for them to seed, right, in
Yes,
other or
yes,
parts
yes.
of the
Correct.
body.
And
Uh-huh.
even the test itself for BRCA, you get only 3 results, like it's positive, it's negative, or it's ambiguous. So even if you get positive, then because there's so many mutations of the gene, remember it's the mutated gene that causes the cancer. And there's so many mutations, and they're still mutating. So you are not sure whether
Right.
what you have is the one that really causes the breast cancer.
I think the solution there is this. If I can afford it, I'll have it. If I can't
Yes,
afford it,
that's
I'll
it.
survive
Because
anyway.
Angelina Jolie
Yeah.
can afford to have the prosthesis or the
Yes.
implant.
Uh-huh.
So there's no change in her cosmetic appearance.
Well,
Okay, Doctora, I'm afraid we've reached the end of our segment. So maybe if you have some parting words for our viewers, okay, we can start with Dr. Gonzalez.
There are many cancers now that are amenable for prevention and early screening. So the dictum of having an annual checkup would be a realistic advice for all people, men or women,
Men or
who
women.
are prone to cancer.
Okay, thank you so much, Doctor. Dr. Capito?
Cancer awareness is a very important issue, not only for breast, but for all types of cancers. And as Gil says, we already have modalities for early detection or even screening. And for breast cancer particularly, self-examination is very important for early detection.
Okay,
And
thank
very
you so
cheap.
much.
And very cheap, yes.
Right.
Okay, Father Jerry.
Well, we have to continue with our research and studies about this cancer or any kinds of diseases, if only to uphold that great dignity that we should never ever lose. That's
Okay.
why we should always take into consideration the things that have been given to us that forms our dignity. And hopefully that in the future there will be treatment for cancer.
Thank you so much, Father.
Well, for me,
Doctora
short
Sanchez?
of being considered a hypochondriac, where you're so conscious, anything that crops up, any buccal there, you have to have it tested. I think it should be a part of health issues, no? That you should be aware of everything that happens to your body.
Okay, thank you, Doctora. Admittedly, women dread cancer so much that many are willing to go for extreme measures just to avoid it. Taking out healthy organs to preempt the disease could be a solution, but it raises valid ethical questions. However, looking at it from a bigger picture, is it really possible to preempt the big C? Thank you for watching this episode of Medical Dilemma. If you would like to send questions, comments, or suggestions, please email them to heavenlycrestproductions@gmail.com. Watch us again next week, 6 p.m. here on GNN for a discussion on Alzheimer's, the forgetful malady. You can also catch us every Monday from 11 a.m. to 12 noon. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you.
Medical Dilemma